So before I start, I would like to tell something about myself. I'm Drisha Pathak. I'm from an organization called the Protect Our Planet Movement, which is an organization that basically works with young people to inspire them with knowledge, as we see that young people are more and more coming up to conduct strikes. They are also leading some action based projects, but most of them, they feel it clueless to where to go and how to find direction and actually taking action. So the Protect Our Planet movement helps in capacity building and knowledge building, so that they can come out and work on their own projects with the help of the mentorship that we provide. So the project that I'm going to present is on the plastic food contact materials and the assessment of the understanding of the health professionals and the non-health professionals, the knowledge, the practice and the attitude towards using plastic food contact material. I'm basically a public health professional, and I have a keen interest in climate action. So that's how I, started working in this area. And now I would like to share my screen to start with my presentation. So this is part of the climate and health project that we are leading with the POP movement, and this study was basically conducted in India, in the capital of India, Delhi. As I am closely working with the health professionals, it was my it was my experience that took me to get into the detail that why even the health professionals are using plastic food contact materials in such quantity in India, where at international level people are trying to leave it as soon as possible because they understand the chemicals that are being leached. So to first understand the knowledge and how they are practicing it, and what is the attitude towards once they know about using plastic food contact materials, how they are practicing it in their daily life. So this I don't need to go in detail with this explanation of what is plastic food contact material and what are the chemicals that are being released, but I would like to specifically specify the NIS and IS, which is the non-intentionally added substances and the intentionally added substances in the plastic that leaches out once they get exposed due to the various environmental like temperature or other factors that facilitates the leaching of the chemicals into the food which it stores. Now, the chemical migration is through the packaging or through the storage material, or even if you are transferring the food product from one container to the other container, and it depends on different factors like the food, the type of food, the temperature, and how the plastic has been manufactured, like what is the type of the plastic that is being used. So initially we did a lot of literature review to understand that how many studies have been conducted to actually understand the gap analysis, to understand whether people are actually aware of the chemical, the leaching process, and how is it impacting the human health, and are they aware of the EDCs, the endocrine disrupting chemicals that are being released, and the different types of plastic food contact, the different types of plastics in which you can store a food, and the quantity of chemicals that each of these plastic has. So one thing that to specify is that in every country, the level of the chemicals that can be used to manufacture and then the plastic that can be used to store the food depends on the guidelines that have been provided. And in India, I'm sorry to say this, but there are no such regulations where you can pinpoint that this kind of plastic is having this amount of this amount of chemicals, and the toxicity of the plastic is this much, and therefore this kind of plastic should not be used. So after doing some literature review, we came to this point that a very limited CAP studies have been done, and if we specifically talk about India, then it's even less. So once we finished the literature review, which was required to actually support the kind of research that we were doing, we came up to a point where we wanted to understand that, how are we going to present why there is a need to actually do a gap analysis of something like which is now known to everybody, because facts are very important to actually advocate. So as part of the movement, the job is to actually come up with facts, the figures that are required to actually convince people and make them understand that, even though you know about it, the way you practice it is different from the way you know. So that was the real reason why we came up with this research project. And we wanted to understand that whether people are aware that what different kinds of chemicals they are being exposed to or not, and are they doing enough research about it, are they interested in knowing that. So in India, the plastic, I mean, on a yearly basis, it is presumed that with by FICCI, the fact says that 11 kgs of plastic is consumed by one individual in India every year, and which is supposed to increase to 20 kgs by as we go from 2019 research to now. And it contributes about 8% of the total, and Delhi contributes about 8% of the total solid waste that is produced in India of plastic. Now, talking about some general facts, India accounts for 18% of the world's population, and 4% of the world's water resources are found in India. And and once we did the literature review, we found out that there are very limited studies to understand that what is the level of chemicals or PFAS that in the water bodies, the existing water bodies that are the main source of drinking water or daily use water in India. So Ganga and Brahmaputra Meghna system is a river basin system that provides the major water to the country, and it occupies around 43% of the catchment area. Now, after even after contributing so much to the need of the water resources of India, the studies that have been done on this water body is also very limited. There was the most recent study that was done and is published now. It was in 2016, which mentioned that that there are 15 PFAs found in the Ganga River, and it found that the PFH's level is around 4.7 nanogram per liter, and for and some PFBs as well. Talking about the different PFAs, I think all of us are aware about the different types of PFAs that have been found in bakery packages or takeaway boxes, or the lunch boxes, the plastic containers that we use, because most of the focus of the study was to understand the packaging material. So that's why we are talking about PFAs mostly. Now, talking about the biological impact, as we know that PFA binds with the protein and persist in the body where they are mainly detected in the blood, liver, kidneys, affecting the endocrine system mostly. It has been found in the researches that it affects, and has been found in the breastfeeding mothers by the study conducted in different countries, which included India. So now, coming to the aim of the study, the goal of the study was to understand the knowledge, attitude, and practice among the health professionals and the non-health professionals in Delhi, and to actually understand what is the level of dissonance from knowledge to practicing what they already know. So these are the questions that were asked during the interviews that were conducted for knowledge, to understand the way they are, what is their attitude towards using it, and how much they're actually on a daily basis practicing the use of that. So it was a cross-sectional study, and we used a mixed tool where we had a round of interviews where we used quantitative as well as qualitative methods to collect data. And we had around 37 health professionals and 25 non-health professionals. These were all mostly young people within the age group of 18 to 40. So the entire study covers that age group and the knowledge, attitude, and practice of that age group. Talking about the knowledge, whether health professional or non-health professional, the understanding of endocrine chemicals was very low, in the sense that they were not aware that what kinds of endocrine chemicals are associated with the plastic food contact materials. Now, talking about health professionals over here, I mean people who are working in public health, people who have done their graduation in, as a medical student, or they have practiced homeopathy, which is a traditional form of medicine of India, and homeopathy. So we found that 80% of the respondents had no idea about the names of the PFCMs that are being released, and just about 13% were aware of BPA, because it is found, and their awareness level was only restricted to the PET bottles that are available and the existence of BPA in that. 60% of the respondents who answered the question they were aware of the diseases that the leaching of chemicals can cause, but their responses were limited to making a guess and saying that it can cause you cancer, but whether it can impact your reproductive system, whether it can impact your other glands, they were not really aware of that. Talking about the attitude, their decision making was based on three major things that were the cost of the material that they are using, then their need. If they have to store and they cannot find a substitute, definitely they will use a plastic container for that. And then the ease of carrying and from one place to another due to the weight or due to the availability in their kitchen or in the outside market. And it was found that the resilience on plastic material per day was more in the health professionals, in spite of them being aware about the plastic food contact materials and the leaching of the chemicals from that. The type of the plastic used by packaging for packaging the food was of least concern for them while they were buying food items from outside, ordering food outside, and they were not even aware about whether they should use hard plastics or soft plastics. They never checked, the type of the plastic that they were using, 1, 2, 3, 4, 5, and most of them, they didn't care. For them, it was like a one-time use. So they like, we store food for a very less time, so we don't think that the chemical can leach out of that. So this is a very important finding from the research, because we found that the use of we compared how they are practicing it, the health professionals and non-health professionals, and this brings out clearly that what kinds of different plastics they are using on a daily basis, and which can in future help us to actually focus on what kind of awareness material or information we need to provide them to make them stop using it, and also analyze that the type of plastic that they are using to contain their food or water, or it is because of the packaging that is already available in the market, that they are not able to replace plastic in their life.
2 minutes remaining.
Sorry?
2 minutes remaining.
Okay, thank you so much. So as I mentioned, that the age group was from 18 to 40. So we found that when we asked them how how often you order food online, because in India, the food is available in a plastic packaging itself. So we found that the maximum use was the maximum food was ordered online by within the age group of 25 to 40. So that is of major concern, that and also becomes our target population to actually reach out and convince that they need to be aware of these leaching and endocrine disrupting chemicals. Now, when we ask them what are the challenges they are facing to replace the plastic, as I mentioned previously, their needs are the use is dependent on the cost, the need, and how easily available or accessible the product is, and they were more interested in not carrying it for a very longer time, and there also limitation of their knowledge about the chemicals that can leach out and the environment that can help in leaching out of the chemicals. So we found out that the level needs to be increased by making people more aware of different types of plastic, especially 1 to 5, and of course they should not use it. But there was a lot of dissonance that was seen among the knowledge and the practice among the health professionals as well as among the non-health professionals. So I won't go into recommendations for now, because it's a global platform. But the current steps that we initiated once we started, we got this kind of information, is that we developed a project called the POP Conclave, where we do capacity building workshops to support youth-led projects in planning and implementation of their own individual projects. And we are currently working on a project called Blue Economy, which is a group of students from different schools from UAE as well as India. Then we are supporting young people even at the age of 10, 12, or 15, who are working on creating bioplastics in their school labs from different products. And we are also supporting one of our partner organization, which is developing a Irvis fish, ship which can clean the plastic debris from the sea. And we are also doing more work in terms of adding more literature related to PFCM and the knowledge, so that more and more people can, once they know what is the label, they can practice and work on more projects. So that's about it. And this is my information if anybody wants to contact. And if you have any questions, please, you may go ahead. Thank you.
Great. Thank you so much, Drishya. That was a really interesting presentation. Unfortunately, we don't have any more time for questions.